Good afternoon, everyone, and welcome to A Gathering Place. And we have a great show for you today, rolling right into tomorrow's Thanksgiving holiday. And I hope everyone you have plans to be with your family and reconnect, especially in this time of COVID. We have a great show coming up for you. We're introducing a new neighbor during our Public Health Awareness Day. You know, that fourth Wednesday is about public health awareness. And of course, holiday tips, upcoming activities in the community from St. James Health and Wellness. I'm just really excited about the show and what's happening today. So we will see you in a moment right after this opening.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question. And we're back, and I just can't wait. Let's just go ahead and do it and introduce our new neighbor, Dr. Lillianne Lewis Debnam with St. James Health and Wellness. Dr. Lewis Debnam, thank you for joining us today. How are you?
I'm doing great. Thank you so much for having me. I'm really excited for this opportunity.
I'm excited that you joined us, and I know I'm just going to say this quickly. I know it's unprofessional, but I just want to say it because I think we need to uplift our sisters. I love your hair.
I gotta get it done for the holiday, but I got some treatments going.
But you do it. Hey, it's beautiful. What I want to say, thank you for joining us. And I'm just so excited to have you here. It's always good to have fresh new faces, bringing new perspectives, and of course, new services to our community. So why don't you tell our viewing audience who you are and what you're doing? And welcome, by the way.
Thank you. Well, as you already stated, name Lillianne Lewis Debnam. I gotta make sure I include the hubby in there. I am a native of Atlanta, Georgia, and so we have changed our life and are going on an adventure and have moved to the Georgetown community, so I can get to know some fresh faces, as you said, and address some needs for our pediatric community. I like to call myself a pediatrician with a passion for public health. So just to know a little bit about my journey, my dad is a scientist. Ooh. So he's a physicist and a meteorologist.
Wow.
My mom is an archivist. So she is kind of like a historian who takes on like pieces of everything to create a library of whatever that history is. And so she works at the Martin Luther King Jr. Center for Nonviolent Social Change here in Atlanta. And so those two came together, and I feel like that's how you got me, somebody who's all about science and medicine, but also social justice and history. And so that really is who I am.
Well, I am impressed. I must say, I'm impressed. Smart young lady coming from smart parents. And since you mentioned history, let's get together. There's a Black History Tour of Georgetown. I would love to invite you on. But yes. Continue.
I'm trying to get to know the city and figure out the places to go and the people to see. But yeah, they'll say it's just all genes. I didn't do anything. That's how it works. So I went to Spelman College, which is a historically Black college in Atlanta, Georgia, for my initial schooling. I went up to Duke School of Medicine up in North Carolina.
Congratulations.
To do school. Thanks. I went over to the other blue, UNC Chapel Hill, where I got my Master's of Public Health. And then I came on back down to Atlanta because my grandpa was like, I need to see you a little bit more often. And I did my pediatrics residency at Morehouse School of Medicine, the pediatric program. And then I kept going. And I did 3 more years of a fellowship at the Centers for Disease Control, or CDC. I was really passionate about asthma. When I was in residency, there were 9 kids that passed from asthma. And I was like, this makes no sense. This is so preventable. And I wanted to know what we could do at a higher level to address asthma. And that's what took me over to CDC. So I spent 3 years kind of just being immersed in how they make policy and guideline decisions. I even got to work on the Zika epidemic. So that was an amazing experience, but I really, really miss my babies. And so came back to do clinical medicine. So I've been working in Atlanta for about 3 years until I moved over to South Carolina.
Well, we're honored to have you join us. I am impressed by your academic and experience resume, and wow, we look forward to you getting to know even more of the community, and the community getting to know more of you. Really impressed, and we do have a Duke connection, so I'm proud that you went to Duke. I just got back from Duke in September. They named the sociology psychology building after my cousin, who lived
Oh,
could yeah that's the right one. Yeah, she was one of the first 5.
that's awesome.
She was on the board of trustees and also the Duke Endowment Board. So Duke is near and dear to my family's heart. She's my mother's niece, my first cousin on my mother's side. So yeah, when you say Duke, all right, we very proud.
My hubby
Boston
loves Duke
University, South
too.
Carolina, but he went to Duke also.
He didn't go to Duke, but he loves Duke. He's from Youngsville, North Carolina, which is not far.
All right, very good. So yeah, we got some Duke's ties, and my cousin just retired from Duke a couple of years ago as a professor there, economics. So yeah, there's some ties there. It's good to know. See, we all got ties, and I got some neighbors who went to Spelman also. So very good. You know, once you start talking, you start connecting all these dots. So maybe before it's over, we're gonna be family.
Right. Already.
Very good, very good. So you're here now in Georgia. We're very happy to have you. So tell us a little bit about the pediatric services at St. James Health and Wellness. What if I want my child to be a patient? I don't have children, but I want my viewing audience. We want them to bring their children in. What type of services do you provide for the pediatric patient?
Well, pretty much everything and anything. We do well child visits. For ages 0 to 18. We also have, if you need to get caught up on your immunizations, we have those services. If you need a sports physical, we also have a little bit of women's health. But it's really great that at St. James, we have a lot of family medicine providers who can support us in doing some of our contraceptive services. We also have a really awesome program called Healthy Families. So it's housed right there in our St. James Health and Wellness Georgetown Pediatric Center. We got a new long name. But Miss Ophelia Britton is the program manager for that program, and they seek to support families with kids 0 to 3. Right now, they're enrolling families with babies under 3 months of age. But yeah, they can do home visiting programs if you're needing any sort of assistance or need somebody to talk to or want to talk about just parenting tips or they are a great hodgepodge of activities. Other things we do, like when you come for your well child checks, we're going to give you a book if you're under 5 years of age every time you come to visit us. We also try to support and promote dental health. And so got toothbrushes. We're trying to work on getting dental services for our kitties. That's in the pipeline.
Oh, that's good.
And we're also going to be expanding our reach outside of our sort of brick and mortar clinic. So we do have a school-based clinic at Andrews Elementary currently, but we're going to be opening up 2 more sites in just a few weeks. at that Andrews cluster. So we'll be at Andrews High as well as Rosemary Middle. Let's see, there's myself, there's Dr. Heather Richardson, and then we have 2 nurse practitioners, Anna Newell, who is primarily at our school site, and Miss Erica Honeycutt. We have an awesome nurse practitioner, but she's getting ready to retire in just a few weeks at the end of the year, Miss Joyce Petrusik. But she's been there the longest. She knows Georgetown. I'm so sad to see her go, but it won't be forever. And we'll be welcoming a new nurse practitioner in December, Miss Elizabeth Brockington. So we've got a nice team of providers, of nurses, of front desk staff, and we can't wait to see you guys and to meet your families.
So this is all dedicated. The folks that you just listed are all dedicated to pediatric services. Mm-hmm. Wow, that's impressive. And we want to encourage folks, call the number at the bottom of your screen or visit the website to learn more about the pediatric services. Definitely St. James Health and Wellness, you're making some really good moves when it comes to pediatric services. And you guys, if you're looking for a pediatrician for your child, definitely give a call to St. James Health and Wellness and get your child in, especially in this day and age. You mentioned on your resume your concern regarding asthma, and am I correct in saying you said that you experienced the loss of 9 pediatric patients? That's tragic,
right?
And in this area, I think we have some unacceptably high numbers regarding asthma, and it's an environmental issue. It's where you live. Not knocking. Well, I guess I am. We have a paper mill, steel mill, a coal generating plant. These all lend themselves to increasing asthma rates, and it has created a middle class financially, but health wise we have paid a price, and in particular our children. So it's good to have someone of your caliber in our community who understands that, and I hope that we work with you to help make a difference. And the first thing we need to do is, if your child needs a pediatrician, you can call the number at the bottom of your screen and make that appointment. So thank you very much. I really appreciate you bringing that up and letting us know about your services. So we have some other stuff coming up, I understand. St. James Health and Wellness. You're not just in a brick and mortar, as you said earlier, I think when we were talking, but beyond the brick and mortar, we're out into the community. St. James Health and Wellness is building partnerships, and I would like to take a few minutes and let's talk about that. So what upcoming things do you have?
Yeah, we've got a lot of fun coming up for the holidays. One thing that we'll be doing on December 8th, which is in partnership with Triple P Georgetown, is a holiday parenting workshop. It's going to be at the Howard Center at 5 p.m. So that's on a Wednesday. And they're basically just going to have tips for parents. You get to talk with other parents on how to create a hassle-free shopping experience, home holiday experience, healthy eating, home safety. They're going to have some special visitors from the North Pole. They will be providing dinner as well as childcare if that's needed. And then every family that comes to visit will get to have a take-home kit of activities to do on the holidays. So
I just love the holidays when children are involved. It just brings not only children who are children now, but the childlike spirit that we all had. And it's great. I think this is wonderful that you're really giving good support to the parents, because we often forget that holidays can be stressful, and to bring the family together or just provide presents for your kids. So this is a great opportunity for parents to just get a little pampering, get some tips helping you cope with the holiday spirit and everything. So wonderful. Was this your idea, or was it a team?
I wish it was my idea, but it was already in the works when I got here. I've just been here about a month.
Okay.
And so this triple P stands for Positive Parenting Program. And so it's a collaboration between Tidelands Health, the Black River United Way, and Children's Recovery Center. So they are the ones who kind of brought this all together, and they're one of our good partners. So we are happy to kind of collaborate with them in that regard.
Very good. And we have some other holiday activities coming up also. And those activities are
Yeah, so this is our holiday food giveaway. So we had a turkey giveaway a few Saturdays back, getting everybody ready for Thanksgiving. And now we're going to have, because we got a whole bunch of other holidays coming up in December, having some food giveaways in collaboration with Low Country Food Bank and Mount Olive Baptist Church. So this event will be held at our Choppy site. And that's going to be on December 16th, which is a Thursday, from 11 to 2 p.m. And so you can just come and visit us and get some yummy holiday goodies.
This is wonderful. I was just in a presentation last week, I believe, where some research was done regarding food insecurity in Georgetown. And it is programs such as this that really lends itself to helping decrease food insecurity in Georgetown. And that goes to decreasing health disparities and also decreasing poverty, because it's all interconnected. So I am glad to see the St. James Health and Wellness is just taking a step forward and making these type of programs happen. So this is December 16th, 11 a.m. to 2 p.m. And that's food distribution, holiday food distribution. So if you guys are in need for the holiday, just come on out to this food distribution sponsored by St. James Health and Wellness, Low Country Food Bank, and Mount Olive Baptist Church in Dunbar at the Choppy site.
Yes.
Yeah, at the Choppy site. All right, very good. And what else do you have coming up?
So
or happening, I should say.
Yeah, because we're actually doing it right now. But one other big event that I wanted to make sure we included for everyone was open enrollment. Health insurance, the marketplace is now available. So November 1st through January 15th. And I know it can be somewhat daunting to kind of sift through that website and say, well, which plan is right for me? And so we do offer those supports. We can't tell you what plan to get, but we can help you kind of navigate. Well, this is what my family looks like. These are the needs we're expecting to have. And they can say, well, here's the set of plans that could work well for you. This is how much it would cost. So if you're needing some supports, if you're looking for health insurance, we do encourage everyone to try to get it if you can, to cover for those unexpected things. But we're here to help in that regard. And we've got our phone number right here, 843-826-3773. But our outreach team, led by Miss Linda Lina, is really awesome. They're great insurance navigators. Please contact them if you are in need.
Yes, they are. They're actually very good. I've been had the opportunity to work with some of them, all of them, and I'm glad to see that. Just call this number, get enrolled in health insurance. Y'all, it's so important. If it was not for the Affordable Care Act, I would not be able to do what I'm doing as an entrepreneur. So, it works. Go ahead and get enrolled. It is sometimes daunting, but you have a phone number, 843-826-3773, where you could get some help, and they'll walk you through it step by step. And I know Miss Linda Lina, great spirit, heart, will just take care of you and walk you through it. So it's good to hear about that too, that reminder. If you enroll, because I had Linda on here before, make sure you enroll by December 15th so that your insurance will start January 1st. After December 15th, there's going to be a bit of a delay. But if you are already enrolled or plan on enrolling so you could get it by January 1st, go ahead and get enrolled now. Go ahead and take care of it by December 15th so you do not have a lapse in your insurance. So that's very good information. I love it. Thank you, Dr. Lewis Debnam. I have to remember that, y'all. Say the whole name. All right. So So y'all, I have a list. You know, we got to make sure we we talk about everything, y'all. So I have a list, and our next thing is it's holiday time, holiday season. Tomorrow is Thanksgiving. We hope everybody has a wonderful, happy Thanksgiving with family and friends. But because we have a pediatrician with us, yeah, we want everyone to have a safe and healthy holiday. So, Dr. Lewis Debnam, you have some healthy holiday tips for us. Can you share some of those with us?
Of course. In the spirit of our public health awareness and my public health love, I was like, I can't go by without giving some safety tips, some prevention tips. So, of course, not everyone is traveling, but a lot of us are traveling for the holidays. And so just some basic things like making sure you're wearing your seatbelt in the car, because we do see increases in accidents around this time with all the extra holiday travel. These temperatures, they've been up and down, but it looks like we're going to be pretty cool over the next few days. So making sure you've got warm layers, but that are light. So you can multi-layer if you need. Gloves, mittens, hat, scarves, but stay warm because when that temperature drops, it makes it harder for your immune system to fight off things. And so we want to try to avoid those colds, and flu, and COVID, and all that other stuff out there.
Keep away from us.
Bundled up. But the other thing when we're thinking about bundling up and also just traveling in the car is for our littlest ones who are in car seats. Sometimes when you got all that heavy stuff on, it makes it so that you can't buckle your car seat correctly. So we do encourage to have those warm layers, but instead of the baby or kiddo being in their big coat in the seat, you can have their coat off and have a thick blanket over them or lay the coat over them so that you're still staying warm, but their seat belt or in car seat are still secure. So
I have thought about that detail.
Yeah.
That's important to know. You know, when I had when my nieces and nephews were little, didn't even think about that. But thank you for saying that detail. Go ahead, continue. This is good information.
That's what I'm always thinking about. I'm like, people don't even realize. Let me throw this out there. So of course, lots of cooking, especially around Turkey Day. So just little things like checking your smoke alarms to make sure the batteries are active, that it works, because we've got some great cooks, but even the greatest of cooks sometimes have a little slip up. So having a smoke alarm is just another safety parameter. And then we've got lots of kids and even pets running around. Everyone's excited to be together with family and friends. But when possible, you want to try to keep kiddos and pets outside of the kitchen, or at least 3 feet away from hot surfaces. Don't want them reaching up on the stove. You don't want those pot handles hanging out over the side where they can catch them, or if they're running by, might hit them, because sometimes we have seen like bad burns, even like with your fireplace. A lot of times you'll have fireplace covers, but those can get really, really hot. And so if they're touching them, we can get some burns. So just having, home safety, especially around hot surfaces. And then thinking about like our space heaters, don't leave them unattended. And don't leave food cooking on the stove because sometimes that'll spill over and start a fire. The other thing that I think about with kids and when families come together is it's a great time for like grandparents and grandkids to spend time with each other. But a lot of our grandparents may have health conditions or chronic conditions like diabetes or high blood pressure, and they have to take medicines. And so those medicines might be in grandma's purse, or it might be on the nightstand because they're coming to visit. And so they placed everything out. And sometimes, medicines will look like candy to kiddos. So trying to make sure that everything is up, and away and out of reach, out of sight of kids. So putting our purses up high, getting those medicines out of their sight, because we don't want to have accidental poisonings. And then my last tip was just stress and sleep. A lot of times we're losing sleep, which then causes us to be stressed out because we're trying to cook all this great food or we're traveling to see our families. And so it is totally okay to take a break. If you're feeling overwhelmed, just take a step back. And I always like to encourage everyone, if you can, have a few hours, at least a day, to just rest and recover from all that holiday preparation and all that holiday fun.
That's
So
right.
those are my holiday safety tips.
You know what they say after a vacation? Sometimes you have to take a vacation after the vacation.
Mhm.
When we were growing up, when we would go on family vacations or trips, we would try to get back a day or two early before we had to maybe start school. Well, weeks early if it was school. But you would come back just to rest from the vacation and get settled. And it's the same. We don't think about it, but with holidays, we're excited. Family is here, like you said. Children, the pets are running around. And it's good stress, but it's still stressful
Mhm.
and it
Mhm.
wears you out. So, and I say this because the older I get, I need some rest.
I get tired too. So
I
I'm
like
like,
my
let me
quiet
tell
time.
everybody,
I like my
make sure
quiet
you get
time.
rest.
That's right. I need some hours. I got to go to bed early and get excited about going to bed early. Woo, girl. Anyway, but I'm glad you
Me
mentioned
too.
that. So I have a show on Sundays also at 4. We do this show again. And y'all, I might repeat this show or have a special holiday show. But this is good information, not only for Thanksgiving, but we're entering the holiday season. This is
Exactly.
good. We have Christmas. We have, I think I've read someplace like 26 different holidays around the world this time of year. And the one thing we need to do is pace yourself and rest.
Mm-hmm.
Yeah, because we all got to go back to work at some point, or we are doing something, and it does pay to take care of ourselves. And I just love that you shared those healthy safety tips with us, so we can enjoy our holiday even more. So wonderful, thank you. Is there anything else we need to know, Dr. Lewis Debnam?
Well, I know I talked a lot about pediatrics and kids, but of course, at St. James Health and Wellness, we do have adult services too. Not at my pediatric center, but we have 6 family medicine sites
Mm-hmm.
across kind of South Carolina. But we service the Berkeley, Georgetown, and Charleston counties.
Mm-hmm.
So if you're a parent or a grandparent and you're in need of healthcare too, you can also call our just main number and get access to care. We do have some late hours. So for the family sites, they go until 6:30 on Wednesdays. Typically, it's 8 to 5. And for us, we at the pediatric center we do Saturday hours from 8 to 10. And so I'll be there this upcoming Saturday after the holiday if you need to walk in and get care.
All right, very good. I'm trying to pull up. Here we go. See if I can get the website here. There we go. You go to the website where they list all the locations.
Mhm.
So it's you can see there and the nice little pictures and everything, folks. And all those pictures and locations of you know across Georgetown, Berkeley, and Charleston. So go out and one, if you have a child, you could sign them up with a pediatrician, and if you don't, you can sign yourself up for some services and family members. And I really admire our community health centers, our federally qualified health centers, because they have to provide those services regardless of income and what you can afford. And that is actually a good thing that we need to celebrate and support whenever we can. So when you go to the website, not only go to the website to find out information regarding patients, but go to the website to become an advocate to support our federally qualified health centers. Every August, we celebrate our Community Health Center Week, and now it's gotten so big, it's some places celebrate for the entire month. So
Mhm.
we're going to have to bring you back on to talk about that, and of course, Linda Lina and other members of the staff. Folks, it's been a good informational time with Dr. Lillianne Lewis Debnam, and I can't wait to meet you in person. And we're going to get you on that Black History Guided Tour of Georgetown, so you can learn more about our cities and counties history and meet some more folks. We'd love to have you and your husband join us. Thank you for joining me today. Really appreciate it. And of course, everyone, at the bottom of your screen, we have the phone number so you can schedule your child's appointment or, of course, visit the website. Dr. Lewis Debnam, thank you for joining us today.
Thank you for having me.
All
I'm
right.
so excited to be on, and I'm so excited to be in the Georgetown community. I can't wait to meet everyone.
Very good. And I'll see you in a moment. I'm just going to wrap up this show, but I'll see you just in a moment. Thank
All
you.
right. Happy Thanksgiving.
I know, right? Happy Thanksgiving, everybody. I'll see you in a moment again, Dr. Lewis Debnam. All right, everybody. What a great show and good information. And I want to thank everybody for joining us. And of course, I wanted to share with you today my gratitude and the gratitude of my staff and volunteers for all that you have done for us this year, 2021. We are really moving forward with a lot of programs. We received many grants, one of which will fund the Gullah Geechee Seafood Trail, our environmental and energy programming. We want to thank NOAA and the Climate Reality Project and the United States Energy Foundation, just some of our grantors, and of course, our partner organizations, so many of them that we have and we are building towards. And I just wanted to take a few minutes to share with you my gratitude, my sincere appreciation to our members, to our community of the Gullah Geechee Chamber family of organizations, the Gullah Geechee Chamber of Commerce, the Gullah Geechee Leadership Institute, and the Gullah Geechee Chamber Foundation. And don't forget, this Giving Tuesday is coming up, the Tuesday right after Thanksgiving weekend, that you can donate to the Gullah Geechee Chamber Foundation at gullahgeecheefoundation.org. That's gullahgeecheefoundation.org. And please just take a few minutes and actually gullahgeecheefoundation.com. And if you could just take a few minutes and make a donation on Giving Tuesday, the year is coming to an end. And of course, we are a 501c3, so your donation is tax deductible. So, but regardless of what you can do, we want to thank you and express our sincere appreciation for your support and the volunteer hours and just letting us know how you feel and what's going on in our community, because we look forward to 2022, a year of growth. And of course, the holiday season is just starting. You're going to hear from me again, but I just wanted to take that time to say thank you, everyone. And don't forget, on Giving Tuesday, stop by gullahgeecheefoundation.com and make your donation. All right, everyone, we were so excited to have Dr. Lewis Debnam with us, and, looking forward to having her come back and talk about the pediatric programs at St. James Health and Wellness. And once again, thank you to St. James Health and Wellness for sponsoring the fourth Wednesday Public Health Awareness Day. Look forward to seeing everyone on Sunday. Might repeat this show or at least play some holiday music, so you might not see me. But everyone, thank you. We're so excited to have you with us today. Have a good evening.